A paper on clinical characteristics and disability of subjects with migraine in a tertiary center in Bangalore. My guide is Dr. Rohit Pai, Assistant Professor at the Department of Neurology in Bangalore. So coming to the introduction, we all know migraine is a primary headache characterized by a set of specific clinical features, and it is the second most common cause of headache, most common headache which is related with neurological disability in the world. This diagnosis of migraine is based on the criteria given by the second edition of International Classification of Headache, ICD-2, and from the literature it says it affects around 15% of women and 6% of men for over a 1 year period. Prevalence of migraine in Southeast Asian countries is around 10.9%. Why is this study? As from the literature, it is said about one-third to half of the patients with migraine, they are inadequately diagnosed and insufficiently treated, which leads to increasing levels of disability and poor quality of life, and which affects in multiple domains of their of their functioning, which include social, occupational, academic, personal, and even psychological domains. Hence, it is very essential to identify these patients, to treat them adequately at the earliest, to prevent the disability associated. Coming to the objectives of my study, to study the clinical characteristics of migraine, to assess the disability associated with different types of migraine and their clinical characteristics, to correlate the clinical profile with social demographic as well as the disability. Materials and methods, it was a cross-sectional, observational, prospective clinical study. It was done in the outpatient department of neurology in Padamala Medical College for a duration of 1 month, which was January to February 2017. Inclusion criteria was males and females between the ages of 14 to 64 years which were diagnosed with migraine based on ICHD. Exclusion criteria, those who were not willing for consent and those who suffer from any illnesses. My tools used were Performer for demographic data and clinical data questionnaire. Modified Kuppaswamy socioeconomic status case was used for sociodemographic socioeconomic status, and migraine disability assessment questionnaire. The subjects were recruited by consecutive sampling, and the study was reviewed and approved by institutional research committee and ethical committee. Return informed consent was taken from all the subjects prior to the data collection. They were offered to voluntarily agree or disagree for the same. The diagnosis of migraine was done based on the criteria for migraine by the ICHD-2, and sociodemographic and socioeconomic status details were also taken in the questionnaire. The patients were assessed for clinical status, clinical characteristics, severity, using mirrors. Coming to my results, the first one, frequency tables. Out of the age group, it showed about 52% of those patients belonged to the age group 14 to 34 years. And they had a female preponderance, that was 74% of the subjects belonged to were females. My total subject number was 50, and educational status was about 22 of these, that was about 44% had completed high school education. And occupational status, 23 of these were unemployed, but the rest of them were equally divided under different classes, with professional people being at the least. And 37 of these were married, which was accounted for 74%, and it was almost an equal distribution between urban and rural areas. And the socioeconomic status, most of them belonged to, that was 42% of them belonged to the 4th socioeconomic class according to Kuppaswamy classification, followed by class 3. Coming to the clinical data results, the first variable that we studied was age at onset of headache. Out of this, the criteria satisfied was about 34 of these 50 patients. They had an age at onset of between 14 to 34 years, which is about 68%, which was significant compared to others. And the type of migraine we studied was one with aura, without aura. Majority of these, that was 42 of them, accounting for 84% of them, did not have any aura. Out of the 8 who had aura, they had, most of them had, that was 6 people had visual aura, followed by one of them with sensory, one of them with motor aura. And another important characteristic, the monthly occurrences of headache, where majority of them, that was more than 28%, that was about 56% of these had monthly occurrences of more than 10. Duration of attacks, most of them, 23% of them, that is 6 to 20, had an attack which is lasting between 6 to 24 hours. And the character of headache, 25 of these had typical pulsating and or throbbing type of headache, accounting for 50%, followed by sharp type or dull type, then followed by band-like and other types of headache. Severity, that severe headache was reported by about 28 subjects of these, accounting for 56%. Localization was almost equal between unilateral and bilateral. 23 of them had unilateral type of headache, 22 of them had bilateral, and 5 of them had no localization, that was they had both, either unilateral or bilateral. Coming to association symptoms, in the subjects that we studied, out of 50 of them, 32 of them, according to 64% had nausea, 37 of them, 13 of them, that is 26% had vomiting, 42% had photophobia, 42 of them had phonophobia, 13 of them had visual impairment, visual symptoms, 60%, according to 30 of them, had mood changes, and 41 of them, that is 80%, had associations with activity. And this is a pie chart showing, bar chart graph showing the same. And family history was there in 11 of them, according to 22%. Whereas the severity score was moderate, that was 26 of them had moderate severity, followed by mild, which was 15. Coming to statistical correlation, the relationship between age at onset and family history, Chi-square value was not significant, but in relation with the gender versus family history, it showed that females had more of family history, so it had a statistical significance. And gender versus age at onset also had a statistical significant value, where females who had a younger age of onset between 14 to 34 years had a more statistical significance. There were no statistical significant variables when compared between education and variables. When compared to gender and other variables, family history again, as I said, had statistical significance. In comparison to monthly frequency of occurrences and association symptoms, again do not have any statistical significance, though they were all important. Severity versus association symptoms also did not have any statistical significance. Duration of hours of attack versus localization also did not have statistical significance, but duration of attack in hours versus the association symptoms had a statistical significance in respect of mood changes. In comparison to severity of the headache with other variables, did not show much of statistical significance except for the duration of headache, which was nearly 0.05, so it was nearly significant. Coming to discussion, migraine is a wide spectrum of disease which is characterized by variable number of episodes associated with variable characteristics, variable intensities of pain, causes, implication and treatment of migraine. And this Miller's questionnaire, which was used, is an effective clinical tool to identify the severity of the disease, and it's invaluable in planning for the pain. The current study shows a female preponderance, and majority of them belong to the age group of younger age group 14 to 34. And these demographic variables were almost in accordance to studies done by several previous ones, which included Stewart et al., Steiner et al., and Benjit et al. Family history of migraine was present in 22% of these. The various symptoms experienced, like 50% of them had throbbing pain, 85% had photophobia and phonophobia, and 96.67% had nausea and aggravation with activity. And 52% of them had moderate disability when assessed on MIDAS. The strengths of my study were it was a prospective study which was done in an outpatient clinic, and it used standardized international criteria for diagnosis and standardized tools. Limitation of my study, it was a small representative group, so the generalization of this study is not possible. And it was a cross-sectional study, so an effect of drugs and their effectiveness could not be measured, and the duration of study was short. For future studies, a prospective longitudinal study would be better with a larger sample size, and if included with drug effectiveness would have been a better idea. And in conclusion, migraine is a common neurological disorder with moderate to severe disability which is affecting multiple domains of the human being. Hence, it is necessary to identify at the earliest, treat the patient at the earliest in order to prevent the disability. These are my references. Thank you.
Thank you, Dr. Deepti. This is kindly note that Dr. Deepti has taken 2 minutes of excess time. Any clarifications or questions are welcome.
What is a prominent observation from your study which is not otherwise different from the previous study?
So in the previous studies it was mentioned that there was severe disability, moderate to severe disability. But in my study I found that there was moderate disability. One was that. Another was the younger age group which was more affected, which was more associated with more of moderate disability affecting their, vocational this one. And there was statistical significance between gender and family history, and statistical significance between the duration of attack with mood changes.
And you put your limitation as disability something. What is it? Your limitations of the study.
Yes, sir.
You couldn't mention it something else.
This short number, short duration. Sir.
Any questions?
Is the duration of the study sufficient?
For the diagnostic, for the diagnosis per se, it was not sufficient, but we have considered only those patients who had symptoms for more than 3 months in the past.
Okay, because people approach the demographic picture is not clearly represented. Like many people, educated people approach in urban areas. Uneducated people will be there in rural and other parts of this thing. Because there is no services there, they may not approach it. That's the inclusion criteria and this duration of the study and the population which you select. And also disability, whether they had any other disabilities.
Disability in all domains was noticed, but we didn't do a specific in which domain had a statistics. We didn't go into that aspect. Sir.
Disability only due to migraine. You are looking at if they have
Only
pre-existing disabilities due to anything.
No, because of the pain, the number of hours of whether it affects the entire day of working or more than half of the entire day of work along associated with pain. Only that we have assessed, not other domains.
Is it the quality of life or the disability?
No, it's only the disability. Sir.
Thank you very much. Now, Dr. Preeti.